This is Health Unabashed, broadcasting live on Healthcare Now Radio from the Anchor pop-up studio in Radio and Podcast Row at HIMSS 2026 in Las Vegas, Nevada. I'm Greg Masters, co-host and executive producer, alongside my partner in conversation, the ever-curious digital health aficionado, author, editor, global thought leader, and industry steward, Gil Bash. Together, we bring you the people, ideas, and movements reshaping healthcare, not with hype, but with purpose and persistence. On today's special episode, Gil sits with Christina Madison, PharmD, founder and CEO of the Public Health Pharmacist, a 2-time TEDx speaker, public health advocate, healthcare media contributor, and one of pharmacy's most recognized voices in broadcast and communications. Dr. Madison is a clinical pharmacist specializing in infectious disease and gender-based health, who has spent 2 decades arguing that pharmacists are not just dispensers, they are frontline public health practitioners. She brings that conviction to more than 250 on-air TV appearances, to the White House, COVID-19 Health Equity Summit, and to audiences all around the world. Dr. Madison is a clinical pharmacist specializing in infectious disease and gender-based health, who has spent 2 decades arguing that pharmacists are not just dispensers, they are frontline public health practitioners. To learn more about Dr. Christina Madison, visit thepublichealthpharmacist.com or connect with her on LinkedIn and Instagram at thepublichealthpharmacist. Now, with no further ado, Gil, the mic is yours.
Greg, thank you again for all your hard work here at HIMSS. For those of you who have been to HIMSS, which is the Health Information Management Society, it is really a global NGO. We have about 30,000 people at the meeting. And someone I met maybe 5 years ago here in Las Vegas was Dr. Christina Madison. And it was very, very nice. We met. She is I would say, probably one of the most visible pharmacists when it comes to the sense of bringing pharmacy to broadcast media, speaking to people about the role of the pharmacist, the importance of pharmacists in terms of really being a front line of patient education, patient connection. And Dr. Madison or Christina, has really enjoyed her role, is passionate about the role. She's here at HIMSS all the time, by the way, which is great. I mean, you wouldn't expect to see sort of an army of pharmacists here at HIMSS. You expect to see a lot of people who are passionate about AI, health information, electronic medical records, and the sort. And here she is. So first of all, it's great to have you back on the show. This is a second appearance, which is rare for most guests, by the way. And
I'm honored.
Well, we're honored as well. I'd be just curious, what brings you to HIMSS?
So for me, I feel like technology is the interface that is going to change healthcare. And I want to have a front seat. And that is why I come to these meetings, because I want to see what's going on. I want to see what is happening. I want to see what the latest and the greatest is with AI, interoperability, med safety. It's all here. And ultimately, for me, I'm a healthcare media contributor, and I feel very strongly that I should be covering these conferences, especially for my pharmacy colleagues who are not able to attend, so that I can talk about reasons why attending these types of conferences are so important for us as a profession as we move forward.
Now, you also have a very popular podcast. Is that correct?
So my podcast ended its 3rd season last year, and now I'm guesting. So that's why I feel so excited that I'm getting to guest. I just guest on another podcast.
You're stepping away gives you more time to be on our programs. Thank you so much for that.
Yes.
And I'm just curious. You've just completed your second TED program.
I did.
Give us a clue. What were you speaking about?
So my second TEDx was all around why we need to invest in women's health, and specifically including women and women of color in our clinical research trials, so that we have better representation and that we're able to actually see a lot of these chronic medical conditions that are very different and present very differently in women, that they're actually being studied so that we stop losing lives over it. I think about cardiovascular disease. It's a huge killer of women, and it is number one
killer of men and women. But women more often than not die from their first heart attack and underdiagnosed.
Exactly, because of the fact that they have atypical symptoms, which I discuss in my TED. I also talk about that we're having a moment right now with all things menopause, because, recently we saw the black box warning removed from hormone products in order to allow for women to be able to get better access to hormone replacement during perimenopause and menopause. And for me, it's about preventative care. Obviously, I'm a huge supporter of public health and prevention versus waiting to treat something for a very long time.
It's very interesting because I have a book out right now, and in my book I talk about the fact that it was really not until the 1990s where medicine was acknowledging that women were perhaps as at risk as men for heart disease. It was thought of as a male disease, not a woman's disease. Yet it's basically a non-gender specific condition, and that's why women died most likely they said from their first heart attack. It wasn't. They had presented symptoms before. It was just diagnosed incorrectly.
Yes.
And so I think that's a very, very serious issue that thank goodness you're championing that. And it's interesting, as a pharmacist, you're championing that, not a cardiologist, a pharmacist. Pharmacists see so much that comes in, sort of the back end of the pharmacy where people sort of ask questions about, I need an antacid. And, I sometimes wonder, do pharmacists say, well, tell me more about your symptoms?
Yeah. I mean, that's what I ask, because a lot of times, going back to cardiovascular disease, it's misdiagnosed as heartburn.
That's right.
You see a lot of nausea, you see a lot of fatigue, you see a lot of headache, as a presentation. It's a very atypical presentation in women. The other statistic that I saw that was really shocking to me is that women often will pass away because bystanders do not want to do CPR and compressions because of fears of inappropriate touching.
Right. Well, that's scary. I thought you were going to say potentially cracking sort of a sternum or a chest.
No, they just don't do compressions because they're worried that somebody's going to somehow sue them for touching their chest. Which, by the way, save me.
Well, if someone
save me, you can touch my boobies all you want. Right.
But the reality is, of course, compressions should be done if you can find a pulse, ideally. So it's a life-saving move. By the way, just a quick question, since you're a medical professional. I trained medically initially on these life-saving Annie type dolls. I actually have some that I use to show people how to do compressions.
Yeah.
Initially, of course, when we did CPR, it was both mouth-to-mouth and chest compressions. Now, of course, we've eliminated the mouth-to-mouth component, just chest compressions. Do you want to share with our listeners a little bit of why that happened?
So most people, if they are found non-responsive, if it's an adult, it's usually because of some sort of cardiac issue, right? So some conductive issue, it could be ventricular fibrillation, something's going on with the conductivity of the heart. So the heart is no longer pumping. The challenge is that oxygenated blood now does not have an ability to get to our organs and our tissues. And that is the whole premise behind compression-only CPR, is that most people are found down or non-responsive because of a cardiac issue. And so now we really just have to take the place of the heart. And by doing compressions, we're now circulating that oxygenated blood. Versus if you look at children who are found non-responsive, it's usually because of a blockage of their airway. So they don't have oxygenated blood in which to circulate. So it's more important to give them mouth to mouth or to resuscitate them and to try to get the
child Heimlich.
or to get the foreign object out, versus with an adult, it's usually because of a conductivity
I don't think we explain that enough to people.
We don't talk about it.
They don't think about it because they could do just chest compressions on which is complex in its own right with children. But this is a very important aspect. I want to go back to the pharmacy aspect. Pharmacists, I think we have about 350,000 active pharmacists in the United States.
In this country.
Right. They're probably some of the most accessible health professionals going.
And highly educated as well.
Well, they could have been
so many certifications.
They're all doctors for the most part, but they could have been MD doctors instead of PharmD doctors. Same amount of training that goes on. I often find that when I call my community pharmacy, which I use, which is a non-chain pharmacy, that when I call and I ask to speak to John, our pharmacist, he gets on immediately. He knows the family. There's some sense of longitudinal care that is very important. And even when there's some sort of issue with not enough tablets for some strange reason, like how to work that out. And they're on the phone with the insurance company handling that. Do you want to share us a little bit about the fact that pharmacists are really truly advocates for their customers, for their patients? And actually, I just want to say, when you go to a pharmacy and you go to the same pharmacy often, it's not just about the record keeping. It's that they see you as a customer, whereas in the medical system, we're often seen as not customers, that we're used as the generic term as patient, and it's very transactional. So what's your perspective about the relationship customer component to the, I'm filling this prescription transactional component?
Yeah, I think that, the fact that the average patient has 20 touch points a year with a pharmacy or a pharmacist means that is an opportunity for us to really optimize preventative healthcare and public health interventions, not just to make sure that they have their refill on time, but to get to know them, to establish trust, so that when they do have those big questions about things like vaccinations or whether or not to get a colorectal cancer screening at age 45, or whether or not to be assessed for, something as small as, their risk for heart disease, or, should they get that blood test? Should they not get that blood test? They're able to use us as a sounding board. And I think that, one of the things that you made a distinction is that you do not go to a chain pharmacy. I just want to address that for a second. And there's absolutely nothing wrong with our chain pharmacies. I do think that it serves a very different client and a very different consumer. It's somebody who wants the convenience of being able to go to any store within 5 miles of their house. And usually that's one of the big box stores or the bigger chains. And they don't require that like white glove, one-on-one type attention. Now, for somebody like you who has multiple people in the household who have prescription medications, you being at a community pharmacy that has more of that individualized trust and really looking out for you and your whole family, I think that is a better situation for you. Someone else, that may not be convenient for them. Right. They may not be able to wait the extra 20 or 30 minutes so that John can talk to you over the phone. Right. But for you, I think it really works because they've been able to establish that rapport with you. And I think about my own grandmother, God rest her soul, when she was still alive, she would go to my colleague all the time. It was my classmate from pharmacy school. She was like, Daniel will tell me. And I'm like, Grandma, you know that I have the same degree. She's like, nope, it's okay. Daniel will tell me. So you develop a relationship with your pharmacist that is different than the relationship that you develop with your prescriber.
Just tuning in, you're right on time for Health Unabashed on Healthcare Now Radio. We're live at HIMSS 2026 with Dr. Christina Madison, public health pharmacist, 2 times TEDx speaker, and tireless advocate for pharmacy's role at the center of American public health. We're talking women's health, provider status, AI, and the future of the profession. Stay with us. Dr. Madison has plenty of unabashed truths to share.
So let me dive into this for a little bit, because consumer education is so critical to adherence, to their fulfilling the sort of that's going on. When a doctor sees you and decides to prescribe a medication, you're almost always going to the pharmacy to pick up that medication. And the pharmacist is almost always, or good pharmacists say, do you have any questions about the medication? There's, of course, the prescribing information for patients that goes into the little paper bag.
Right.
All of that. Most people know the pharmacist. Everybody knows a pharmacist. But I'd be just curious in terms of today's training of pharmacists, and you're an educator as well. How much of what type of time is spent with the pharmacist sort of saying, in a nicer way than this, if you don't like dealing with people, don't become a community pharmacist, be a hospital pharmacist. But really what I'm getting at is, are pharmacists trained to understand their role in public health?
I think we could do more. It is something that I emphasized when I was working in academia often. And it's something that I bring up all the time when I am giving talks and speeches, when I'm guesting on people's podcasts. I bring it up all the time. I tell people community pharmacists are public health pharmacists. They just don't call themselves that.
Right.
But we are actively practicing public health principles, vaccinations, test to treat, being able to provide over-the-counter recommendations. That's public health. And, any way you cut the cake, that's what it is. We're just not calling ourselves that. And unfortunately, we're not being compensated for that right now.
That's a real
which is the biggest challenge right now when we think about CMS and whether or not we are being specifically labeled as a provider. And that label is really a hindrance to us being able to practice at the top of our license because we're currently not being compensated for our cognitive ability and our ability to be able to do medication management and to do, treatments for strep throat or COVID or, do something like HIV prevention. We're not being compensated for that. And I don't know about you, but if you were a prescriber, you wouldn't do all this pro bono, would you?
Don't do that at all.
They don't do any of this pro bono, and we do. And so I often have people ask me, well, why should we pay you now? You've never asked to be paid before. And I said, well, the difference is that was prior to having PBMs. And now we have this, middleman that is taking the amount of money away from the pharmacy at the actual point of being reimbursed. And that is different from what it was just 10, 15 years ago. And now we're seeing, a lot of these, assistance programs, patient assistance programs, they're now getting into the PBM game. They're taking a cut. Like everybody's trying to take a piece of a pie. And by the time pharmacy actually gets something, it's often less than what we're getting reimbursed by.
Yeah, people don't realize that sometimes pharmacists are losing money at certain medications, which is really strange. I also wonder, to some extent, you're talking about being compensated for, which is right. And I'm certain that the American Pharmacists Association, AAHIVP, is working on this day and night. I'm sure
their meeting is at the end of this month.
I'm sure it's a mega priority issue for AAHIVP. But and certainly they've done quite a bit in terms of vaccination.
For sure.
But of course, there's a lot of confusion around vaccination right now. We won't go into that, but there's certainly a lot of swirl around vaccination right now. But pharmacists also have been trained to deal with cholesterol management. I know AAHIVP has a cholesterol program. There's
diabetes, weight loss.
So let's just stay with that. I actually, in my book, I talk a little bit about diabetes, so the role of the pharmacist in terms of the fact that if someone is a pre-diabetic, and maybe they're being prescribed a drug like metformin or something like that. I mean, the role of the pharmacist in doing more to support that patient, even in the terms of good health, let's say nutritious food or exercise to lose weight. A lot of that pre-diabetes is not that they're eating poorly or having too much sugar in their diet. It's also maybe that they have 20 pounds that they need to lose. That's pushing up the A1C.
Yeah.
I think pharmacists could play a major role here in the diabetes epidemic. Do pharmacists discuss that?
All the time. I have friends that's all they do is they're certified diabetic educators. That's their whole patient population, is that they are actively trying to reduce both micro and macrovascular complications associated with diabetes. And they are helping with the nutrition, and they're helping with the exercise component.
I've always wondered, there are certain products that are over the counter.
Mm-hmm.
Those are also, often people forget those are FDA regulated as well.
They are.
They have manuscripts. They're tracked. And then there are products behind the counter, like Sudafed D, which
Mm-hmm.
could be used in terms of sort of like misappropriated use, so that they check your license. Why are blood glucose monitors behind the counter?
That is a very good question. Well, a lot of the pharmacies have had challenges with loss prevention. And so some of the more expensive items, I think they tend to put behind the counter. And it's not so much that it's based off of not being able to know how to use it properly and needing counseling from the pharmacist. It's more because it's an expensive product and they don't want to lose the revenue. So a lot of that in those instances is it's loss prevention. You even see it with condoms, which I thoroughly bothers me, because I feel like when you put something like a barrier method behind glass, it makes it seem like the condoms need more protecting than the people.
Right. Well,
and that is a hindrance and a barrier to us having folks being able to have
either
safe
pregnancy or safe sex.
Right. And so to me, that it's loss prevention, but it's a public health barrier.
It's another barrier to the reason that they're created.
Yes.
This is it. Are these issues discussed on the operational level in terms of pharmacy policy?
They are, but unfortunately, because of the corporation side, because remember, pharmacies are part of a larger corporation, right. And a lot of the front part of the pharmacy, you have to walk all the way through all the aisles and all the products and all the things
them, like,
before you get, because it's a loss leader.
You sometimes have to get a bell to get someone comes down. You have to hit a bell to get someone to come down.
Exactly.
To do that. Yeah. So that happens as well.
Mm-hmm.
So obviously there is a theft concern, whether it's diabetes blood glucose monitor or shampoo. It's become a mega issue.
It really has.
Just historically speaking, of course, pharmacies have also become a sort of supermarkets these days. Mm-hmm. They've become like a catch-all for this. Obviously, it's to capture revenue. Right.
100%.
Right.
They're trying to optimize their, every square inch.
Right. So I just question on these big box pharmacies that have all of that. And they're open till midnight, but the pharmacies do close usually at a reasonable hour for the staff.
9 or 10.
What is the voice of the pharmacist in the operation of the big box pharmacies?
Well, it depends on which one. I will say that I have seen some of the bigger, like the Walmarts, the Sam's Clubs, the Costco's. Right. They definitely are actively taking the opinion of the pharmacist. I feel like some of the other chains, like the Walgreens and the CVS's, they will take the pharmacist's opinion, but the implementation and sort of the correction of some of the issues that they have hasn't really been addressed as quickly as I think a lot of the pharmacists would want. There was a huge movement called Pizza Isn't Working, because there were several pharmacists that, it was a female pharmacist. She actually passed away because she had a heart attack on the job.
Oh my God.
Another had a miscarriage. Another died from COVID. I mean, there's just multiple instances where the pharmacy profession was being very harmful, the work conditions that they had. And so there was a big pushback. And so you did at least see them implementing things like mandatory lunch hour so that the pharmacy closes so that the staff can actually get lunch.
Right, so that I find it frustrating with those pharmacies.
Exactly.
I want to.
But that was a big push. But that took a really, really long time to get that. Even just thinking about female pharmacists that want a place to pump if they're breastfeeding and they're making them go to the bathroom. That's against the law. If you have more than 50 employees in the state of Nevada, which is where we currently are at HIMSS, you have to have a designated place for your employee to pump that isn't a bathroom.
Wow.
So the working conditions are not great.
Do you see yourself at times as an ambassador for pharmacy now that you have more of a freedom of space role today? I mean, obviously you're active as a leader guiding the pharmacy initiative, but at the same time you're not sitting behind the counter wearing the white coat.
I am very lucky because I work for myself. I have my own consulting business. I do work part-time for UCSF through their National Clinician Consultation Center. But ultimately, like, I feel like I have the freedom to speak candidly and to openly speak about the challenges that my profession is facing. I really feel like we're at a precipice right now, especially as we're seeing AI take over a lot of things. Our profession, we're either going to have to evolve, or we're gonna be left behind. Where we're gonna have pharmacy and we're gonna have pharmacists, but a lot less of them are gonna be needed to do those dispensing roles. We're going to have automation. We're going to have robots. We're already seeing it with Mark Cuban's company and Amazon and PillPack and all of those things. It's only a matter of time. So unless we start talking actively about being compensated for our cognitive skills, and that is the commodity and not the pill that we're dispensing, we're going to have a really rude awakening.
Well, I think that the wisdom of pharmacists are so critical and so valuable.
I agree.
We talked about my pharmacist, John, and
I would like to meet John.
John is a very special. He's in my book, by the way. I do mention him.
I think that's
because I really appreciate his advocacy for his patients. He treats people like customers, and keep in mind they are. So I want to thank you, first of all, for being at HIMSS, representing pharmacy, being a voice of pharmacists, of being entrepreneurial. Pharmacists really are entrepreneurial. When you open up your own independent pharmacy,
that is the definition of entrepreneurial.
And they sometimes own 2 or 3 even. Yeah. That's mega entrepreneurial in this day and age. But you're out there doing many different things in the gig economy. You're the gig pharmacist, I guess.
Multiple streams of income. That's what
that's very good. What you had a name that for your show that was very clever.
Public Health Matters?
Yeah, Public Health Matters. You're still in public health. It definitely matters.
It surely does.
It's interesting. The subtitle of my book is Why People Matter. And that public health is about what? People.
Yeah, it's about the health of the many versus the health of the one.
It's a thrill to have you back on the program, and I hope you stay in touch with us and continue to do great things, not just for pharmacy, but for the people that you represent. Thank you, Christina.
Thank you so much again for having me, Gil.
It's a pleasure. Thanks.
And that, dear listeners, wraps another transformative conversation here on Health Unabashed. A heartfelt thank you to our global audience and to our guest, Dr. Christina Madison, for her clarity, candor, and relentless commitment to public health and the pharmacy profession. Dr. Madison reminds us that the most accessible clinician in America isn't always behind the stethoscope. Sometimes they're behind a counter, knowing your name, your family, your medications, and your health history better than anyone else in the system. And until that's compensated, recognized, and valued, we're leaving one of our greatest public health assets on the table. Health Unabashed streams live on Healthcare Now Radio Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern. That's 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. Want to stay connected? Follow Gil _Bash, and that's BASHE, and me, Greg Masters, MPH, on Twitter, and that's Greg with 2 G's. Do tag your insights with the hashtag HealthUnabashed. Until next time, keep listening, keep learning, and keep raising your voice with no apologies.